My name is Chipo Mulambo, Chipo Tsitsi Mulambo, and I started the organization Rona Flow Foundation about 5 years ago. So the issue that I've been seeing for the last 2 years, especially during COVID, was the influx of teen pregnancies. And for me, it was shocking. The youngest that we've had in our database is 12 years old. Right now, our youngest who's actively pregnant is 14, and she is almost due. I think she's one of the girls who's behind painting. Mental health aspect is something that is not being acknowledged in Zimbabwe. So what we've now decided to do is we have put in a lot of measures to consider the maternal mental health of teen moms. But the biggest thing that we now have seen is art is helping them in terms of talking about the trauma that they're going through. You can imagine being 14, you live alone, you see a perpetrator every day within the community. And so we were finding ways for them to release the stress that they have. One of the ways that we've seen that's really effective is availing artist therapy. We sometimes have dance classes, but we've also seen artist therapy, and we've connected with Hermit Art.
My name is Hermit Muyambo. I'm a visual artist. I do paintings and drawings, as well as sculpture. I do clay sculpture. So I do paintings with the survivors of the problems that the girls are facing. I'm particularly focused on the girl child, particularly the teenage mothers. So I've been doing outreaches to go and see the situation on the ground in various spaces, and we've been doing our art therapy there, and sometimes they'll come to the studio. Art is therapeutic. The moment we start painting and they're in the zone and they get into the painting, doing the best they can to express their feelings, how their emotions turn out to be, and how they express them on canvas, on paint, and with paint. That's how they loosen up, and in most cases they tell those stories. They can't speak to anyone. They can talk to me about those stories and they offload, and they will be in a much safer space, and they'll be enjoying also at the same time. The one who drew an aeroplane, in our discussion before we started painting, I said, on that day I was saying, you know what, let's look for the happier moments. Let's look for things that you wish to happen, or things that you can make happen in this near future after you've given birth to your child. And then she was saying, you know what, I really wanted to be an air hostess, and this was my dream. And I said, you know, your dream is still possible to have it. And then that's when the decision to paint the aeroplane came, because she was saying, this is what I really wish to be an air hostess. After giving my birth to my child, I can either go back to school, do some other stuff, and try to get back to my dream, which is being an air hostess. So now how does that connect to the therapy part? Already her emotions were thinking positively, which is what we want, the hope, the belief that tomorrow is coming and tomorrow will be better. I feel that's the best thing that can ever happen to anyone. And if any person loses hope, nothing can happen.